Which clinical sign indicates that the palatal impaction of the permanent maxillary canines is present? And the best answer here is D, having a lack of canine labial bulge in a 10-year-old patient. Apologies for the wrong option that has been highlighted here, but when it is the erupting age of a canine, and at that point of time, if there is no bulge present, it does signify that the canine has gone astray from its normal erupting position and most likely is going to be impacted in a palatal position. Furthermore, to highlight the factors that could present as a sign of a canine impaction, I have just taken this clip here, and through this information that is given here, you can get an idea about various factors or signs that will suggest that the canine has been impacted or absent. A3 shades of composite resins should be light cured in increments limited to a maximum of, answer is D, 2 millimeter. Now, the darker the shade, the difficult it is to cure the complete length of composite, and it is essential that we should not exceed a particular limit or a particular width of composite, and with that particular width of composite, it becomes really easy to cure the entire length of that particular increment. The information that is given in this article here will suggest the effects of composite shade, increment thickness, and curing light characteristics on the temperature that rises with composite curing. Now, you might find it irrelevant since we are talking about specifically A3 shade and the thickness of the composite layer, and not about the temperature that rises with the curing. But this is just to suggest the additional information that you could be asked about in one of the future exams. So spend 2 minutes here and develop a concept as to how the composite shade and the increment thickness do play a role in the temperature change that occurs within the composite. In an angle class 1 occlusion, which cusp of which permanent tooth moves between the mesiolingual and distolingual cusps of the mandibular second molar in a working side movement? The best answer here is C, mesiolingual cusp of the maxillary second molar, because this is the cusp which is going to move between the mesiolingual and distolingual cusp of the mandibular second molar in a working side movement, which means the jaw is moving laterally towards the side on which the person is trying to chew, which itself is called as a working side movement. Displacement of fractures is influenced by, answer is D, muscle attachments, as if the muscle is attached to a particular portion of the bone and there is a breakage or fracture, and the one of the part of the bone has been tied together with a ligament to other part of the body, the broken part will be moved away from the part that has been held together by another piece of ligament on the other side, and will be moved away by the force or the pull of the muscle that has been attached to the broken part of the bone. The psychomotor recovery time from nitrous oxide sedation is, answer is A, immediate, and this answer has been chosen based upon the information that we have found on a research that was conducted and available on a very prominent website that carries and holds these research information for access to the public. This is the clip that you can use to gather some more information as to how you can get the immediate recovery after the completion of a nitrous oxide oxygen inhalation process. And through the usage of this information, you will come to a conclusion that nitrous oxide administration does offers the possibility of immediate recovery. A quick highlight on what exactly is a psychomotor function, which itself is basically ability of our humans to control the movements of our body voluntarily with our conscious control. So just by thinking and imagining and visualizing and controlling the movements of our body, once we decided that we are going to do a particular task, and then making our parts of our body move in that direction to get that objective completed. In mucous membrane pemphigoid, a positive Nikolsky sign is the result of, answer is A, separation at the basement membrane. When this separation occurs at the level where epidermis does forms a junction with the basal layers, and the dermis starts from that point of the basement membrane. This presentation was prepared by Dr. Anil, and further to the pathophysiology or the etiology of Nikolsky signs and the key characteristics that you can find when the cellular layers of the structure that are part of the epidermis are observed in the microscope, you will be able to find the information that is given right here. A 50-year-old woman has a history of rheumatoid arthritis, bilateral enlargement of one or more salivary glands and lacrimal glands, as well as dryness of eyes, nose, mouth, and throat. What is the diagnosis? All of these conditions or the signs and symptoms are pointing towards only one condition, which is Sjogren's syndrome, which is a kind of autoimmune disease and results in damaging of salivary glands, lacrimal glands, and result in dryness of various structures. And along with that, rheumatoid arthritis does play a part or become a prominent feature of this condition. So here, so that you can remember, this clip has been taken from the following website just to give you an idea or to help you memorize the various features that are presented along with the Sjogren's syndrome. The radiographic term that is used to describe the more radiopaque bone of the socket and septal crest is, answer is D, lamina dura. Now let's see a clip where you can get an idea what exactly is this lamina dura. Here in this clip, you are having this opportunity to identify lamina dura as two yellow arrows are pointing towards a solid white line that is outlining the radicular area of the tooth, and this solid white line is what we identify as lamina dura.